Good afternoon, everyone. Thank you for joining me, for joining my colleagues as well, and you'll get to meet them in a bit. We're going to get started. Some others may be joining us. I'm excited that there are a good number of you who are on the line at this point in time. I've been looking forward to being with you this afternoon to share with you the wonderful work that we are doing, especially in the midst of the many challenges that we've had of the last few months. And so you'll hear from various of my colleagues throughout these next few minutes that we share with you the great work that we do. That work is possible because of your generosity. And I just am so grateful. I cannot thank you enough for your continued support of our work and your continued prayers. They're important as well as we continue to navigate through the many challenges of the present and going into what I call the new normal. Just by way of some logistics before we actually start the remarks, if you'd like to send in any questions that you may have, by all means use the chat feature on Zoom. You can also send them in via email, and that's to events@neighbor.org. Again, that's events@neighbor.org, or you could use the chat video as well. You'll notice that I'm not wearing a mask, but my mask is never too far from me. All right, you see it right here. And my colleagues will also not be wearing masks, but that's because we are truly appropriately distanced from anyone. And so we are at a safe distance. I want you to know that that is the case, but masks are extremely important to us, and you'll hear about that even more during my remarks and those of the others as well. The mask is never too far from any of us. So with that, let me just mention to you, let me take you back just a few months to early March, actually even late February. We saw what was happening with this coronavirus and the fact that it was spreading and becoming more prevalent. And so we sprang into action here at Father Joe's Villages. I mean, and understandably so. You have to realize that the population that we serve is a very vulnerable population. Many of them have pre-existing conditions. They have chronic conditions. And so the last thing we would want is for them to catch a virus of this nature because it could wreak havoc on individuals and the community as a whole. And so we put together an incident command team immediately. I called together my chief medical officer from our health center and the division heads, basically, and we started meeting a number of times a week. Very quickly, we put together protocols. As far as sanitation was concerned, we're wanting to make sure that we sanitize constantly our various facilities because, as you know, Father Joe's Villages is quite large and is spread out. And so that was an important element as well. Shelters, by their very nature, have density. And so we knew that was not good. So we started separating beds, as an example. We started advocating with the city and the City Housing Commission, the county, the Regional Task Force on the Homeless, and started working with them in order to open up an additional facility. In this case, it's turned out it's the convention center. So we were in there very early on. In fact, we have responsibility for 500 of the beds that are at the convention center. That allowed us to further distance the population within our other shelters, and that's been a godsend. Masks, as I mentioned, are very, very important, and hands washing constantly. So with this, I have to say that we've been extremely blessed in that in all these months, we've had only 10 individuals who have tested positive, and they've been quarantined immediately. Nothing has spread, and these individuals fortunately did not become very ill and have rejoined our population. So I thank God for that, obviously, and it's a testament to the protocols that have been put in place. They're extremely important. Our health center, as you can imagine, has been very busy. They have undergone over 6,000 screenings, health screenings, throughout this entire period of time. Every 3 weeks, they are at the convention center and they administer over 600 tests. They go in and they test about 600 individuals within the convention center itself. And that's extremely important because if anyone is asymptomatic, then that's discovered during these screenings as well. And so they've been extremely busy in doing that. We know that we will not be at the convention center forever. And because the convention center is an economic driver for the region. We want that up and running. Sooner rather than later, obviously, but when it's safe. The important thing is when it's safe. Right there, we're blessed to have a shelter for the time being. At some point in time, though, we will have to be relocating those individuals. So we've already started working with the city, the Housing Commission, again, the Regional Task Force on the Homeless, the county, on what exactly we can do to transition individuals out of that area into other safe facilities, including Golden Hall. You may recall that one of the bridge shelter that we managed for the city was at Golden Hall, and we had the second level of Golden Hall. The hope is that we will be back there at some point in time, and maybe even we can expand it hopefully into other areas within that building itself, so that we can have more people who we serve at a distance and appropriately kept safe by wearing masks and so forth, to make sure that we continue to provide the services that are so necessary. And that's the key. The key is not just bringing people into shelter and keeping them safe, but it's also providing the comprehensive services for which we're known, because that's what makes a difference. That's what helps them to break the cycle of homelessness. So that will continue once we finish up at the convention center. But in all honesty, I think we'll be at the convention center probably until year end at this point in time, considering what's been happening out there in the general population. So in addition to that, we've had a lot of adjustments to make, as you can imagine. We've adjusted our meal programs to make sure that we continue to provide the meals that are necessary, but in a safe way. We don't have congregate dining anymore, all right? And so that's an aspect of it, but we want to make sure that people have the meals that they need, the nutritious meals that they need in order to be able to do well, especially the children who we serve. And so we heard early on that there was additional food insecurity out in the community. And so we went out to investigate actually where that was existing. And so as a result, we've expanded our meal services outside of just our resident population. So at the campus itself on Imperial, and right now, by the way, I am at Imperial on our campus here, the building, the room that I'm occupying right now is where we're having our summer camp for the most part. Most days, our summer camp for our children takes place right here in this building, and you're going to hear about that when you hear from Jennifer Ryan, who's our manager for the Therapeutic Childcare Center. But that's where I am right now. And those from whom you'll be hearing are situated at various other facilities, and I'll talk about that in a bit. But we expanded our meal services here within our campus, and instead of just serving a lunch meal for the public, now we've expanded it to breakfast and dinner as well. We also have expanded it elsewhere in the community. And so what I want to do is I want to invite Rocio Hammersheim, who's our Division Director of Facilities Operations, in order to explain to you the meal services and also employment services, because our education and employment services are a critical aspect of the service, of the programs that we provide, ensuring that individuals have marketable skills in order for them to be able to secure jobs. That's an important element of them being able to be self-sufficient, have the income that they need to go forward. And so Rocio also will be sharing with you exactly how we've retrofitted the EES unit in order to continue to serve our population. So Rocio, I turn it over to you.
Thank you, Deacon Jim. Good afternoon, everyone. It gives me great pleasure to be with you today and to share some of the wonderful things that Father Joe's Villages and our entire team has continued to work with during this pandemic of COVID-19. Today, I welcome you to our food warehouse. You can see behind me the wonderful food that many donors have given to us. And you know, we are partners with the San Diego Food Bank, and I'm very happy to tell you that we are one of their many superfood pantries. In our case, we are here to serve the central part of San Diego. So the food that is available here that comes through food drives, you know, donors, anything, any food that we can get, trust me when I tell you that it's utilized greatly, not only in our dining rooms, but also with the families that come by that in this time of need are very hungry and they need that extra help. In transitioning over to what we're doing also at the village, where we bring the food that is here as well, in addition to our Franklin Antonio public lunch line, where we serve 3 meals a day every single day of the year to our community, we also have expanded, as Deacon Jim said, to breakfast and dinner for our public. Normally that doesn't happen, but we saw the need. We know that those people were hungry. We no longer had people that are feeding them on the street. So we brought them into our village to satisfy that need. In addition, again, in our area of Tucson Academy, where Pierre's Cafe was standing there, we took that advantage and we went out there, but we didn't go by ourselves. We brought over a wonderful outreach team who they help us by taking and bringing more clients into the facility so we can feed them, but also they offer the services that they mostly need. Services like a shelter, like all of the wraparound services that Father Joe offers, and in this case, they will be brought over to the convention center as well. The entire team also moved over to the Hillcrest location. And in that area, it was a little bit different. We had to go out actually in the streets, in the parks, where the people are, guarding themselves from the sun. And we go out there and we bring them a sack lunch and we invite them to come with us to the convention center so that they can have a place to shelter day in and day out. In addition to the food services, our employment and education services also adjusted to the pandemic that we are suffering, because we know that the workplace is now a different place. We know that we need to service different jobs. So what did we do? We went out and said, what are the jobs that are mostly needed and how can we adjust to them? So our employment and education services not only adjusted to servicing our clients one-on-one, virally as well as on the phone. And in some cases, if we thought that they needed more personal help, so we offered that, we refer them to the services that will do that. But coming back to the education services, we are very happy to tell you that we did open the center again. We didn't open as for everybody to come in, but we socially distance. We make appointments so that people can be sitting at a computer lab that maybe before service 20 to 30, 40 individuals, now is 1/3 of that, right? Because we all know that we have to keep the social distancing. And we disinfect everything before everyone comes in and after they leave. So it's working out well. We're reaching out to additional people that need security jobs, and need any jobs, disinfecting jobs, custodial, what have you, so that we can place these clients. We also adjusted our very successful culinary arts program. In the past, as you know, that program is a 12-week program, person to person, but we couldn't do that anymore. So what did we do? We know that there was a need for food, and we had some people that we wanted to teach some culinary skills. So we went into what we call food essentials. And what we do with that is that we cook the food, we assemble it, we put it into packets, and then we freeze it. We label it with instructions on how to reheat it. And now we're able to give it to those individuals in tenant services, in our permanent supportive housing units. Those people that you hear about in the news that they can really get out of their apartment because, they may be disabled. They may be, it's hard to get on the trolley when you don't know if you're gonna get infected or not. So we bring the food to them, and that program has increased week by week. Very excited to have that. I'm thinking that we're going to continue that because it's very needed for those individuals. They will need that food whether we have this pandemic or not. So that has been great news, and it was a way of adjusting our culinary art program to that. Also, what we have done is that we know that our clients need to go get a job, and we know that a wage is important. But you know what? Nutrition is important too. And nutrition with our family is even more important. So we transform, again, some of our culinary skills into cooking with family. And in that program, we're going to teach our clients to cook with their kids. So we're going to have a menu where, one child that is 4 or 6 is going to cook something, and the child that is 9 and 10 will cook something else, and the parents will be there at the end, and they're going to be cooking with our culinary instructor. And at the end of the cooking, they will all sit down as a family and have a meal where we will be discussing what budget do they have and how can they adjust their budget to purchase the grocery bills that they pay the grocery bills that they need to have, so that when they move on to their apartment, they're ready to go. They're really, charged up with the skills that not only know how to cook, but how to feed their family healthy, and the children are excited to be there as a unit. So all of these programs would never be able to have because they're not government funded. Most of them come just from private donors. And we are very happy to tell you that we have done fantastically well because it just continues to improve. And the clients that are getting these services are getting the benefit from it all. So I want to take this opportunity to thank you because we couldn't do that without you. And here we are. I invite you to take a tour whenever you have a moment. We're here, and thank you for your time today, and we're very appreciative. Deacon Jim, back to you.
Rocio, thank you so very much. I'm always impressed by the creativity of you and your team. It's amazing the work that you're doing, especially during these challenging times. So thank you so much for that. I mentioned earlier that I'm in a room here at the Village where we typically hold summer camp. The kids are outside right now, but typically this is where it is. It's a big, large room. It's really conducive for the kids to be enjoying each other and their instructors and so forth. Jennifer Ryan, who is the manager of the Therapeutic Childcare Center and one of my other clients, is with me here this afternoon as well in order to share with you the great work that we're doing. The key here is to build strong families, and we do that by working with the children and working with their family, working with their parents, in order to build those strong families. We integrate not only the academic, but we integrate the academic with the behavioral, with the medical side, with the dental side, with the developmental side, in order to holistically help these kids to be healthy. Because we do realize that these kids who come from homeless situations, if we don't mitigate that in some fashion, that they'll be homeless in adulthood as well. And we want to break that cycle of homelessness. We also are so very encouraged by how resilient children are. If you provide the right resources, you know what? It's incredible how they bounce back. And we see that time and time again. So I'd like Jennifer to share with you exactly what we're doing from adapting virtually as an example to all the other elements with which she works in order to be able to support the children. Jennifer?
Thanks, Deacon Jim. I'm here in the Chinye Hostler Training Development Lounge here in Therapeutic Childcare. And this is where we usually would have our school-age kids here throughout the day. We had to quickly adapt our programs for children living here in the Village. Even housed families found it difficult for school and childcare closures to navigate through. Since the COVID-19 crisis began, Therapeutic Childcare, our child development specialists and our mental health clinicians, we quickly shifted our gears to provide support to over 600 children and their parents. We supported distance learning and continued academic, social, and behavioral development by working with the schools, calling them and making sure that the students had the tools that they needed to be successful in distance learning. We offered Zoom tutoring and daily check-ins for our school-age parents and our child development parents. We've provided more than 600 educational activity kits to nearly 50 families, and we continue to do that today. We provide support to parents throughout the crisis. We provided virtual and distance behavioral health assessments for our families. Then, with the recent announcement with San Diego schools continuing distance learning in the fall, we are gearing up for increased support for our children and parents at the Village. We're committed to ensuring that the children we serve have the support that they need from the community to be successful in school. We need continued support from our community to ramp up these efforts in the coming weeks and months. And we know that our amazing donors share in our commitment to supporting these precious children. At Father's Joe's Villages, we've ensured over 250 people and more than 70 families have remained off the streets through our emergency shelter of families. In Therapeutic Childcare, we've continued to provide programming through the summer months, understanding the importance of play and fun in our summer camps. Our summer camps are providing educational and fun summer activities to over 60 children in need. It includes arts and crafts, science activities, STEM activities, theme days, cooking projects, and more. We are currently in Therapeutic Childcare offering limited childcare to 10 preschool children of parents who are essential workers, and we are hoping to provide full childcare for all ages by the end of summer with safe physical distancing and capacity limitations in place, of course. We are also excited about one of our new virtual supports where we can provide developmental lessons and communication to parents through our new Brightwheel app. This allows therapeutic childcare staff to communicate with parents in real time. It includes uploading lessons that they can access from their homes and their rooms. It updates from the classroom when those children are in the classroom. It updates live, and also includes developmental tips and activities. If a parent doesn't have a smartphone, it's okay. They can still access their messages online, or therapeutic childcare staff can also print out updates at the end of each day. Thank you, donors, who make this extended service possible. Back to you, Deacon.
You know, one of my trips to the Therapeutic Childcare Center throughout these months, I noticed there was a distinct absence of children. As you can imagine, when this first hit, we wanted to make sure that they were safe, and so they were within their own residential areas. And the staff was keeping touch with them constantly and throughout various methods, but the kids were missing, and it was so very obvious. And the staff, they were lamenting that they were missing the kids. We miss the children when they're not with us, either the preschool children or even the in-school children, because they come in after school in order for tutoring and the like, as Jennifer mentioned. So anyway, we're glad to see that summer camp is now alive and well. The kids are happy as could be, and they're enjoying that. So Jennifer, I thank you and the work of your team as well. Let me turn now to one of our key initiatives, actually, that we instituted about 3 years ago. And it's called Turning the Key. You'll see that behind that key behind me, which denotes that our Turning the Key initiative. San Diego has an affordable housing crisis. We know that. It's not the COVID-19 pandemic that has caused that, though the pandemic has worsened the situation. We're concerned, I'm concerned, that looming are evictions when maybe these rental moratoriums cease, unemployment checks cease, and then individuals find themselves that they're still without jobs, as an example, and they have to pay rent. So we're concerned about the going forward and possibly more people falling into homelessness. And so the Turning the Key initiative, which we began about 3 years ago, as I mentioned, is an answer to that, and it's especially critical now. As I mentioned, there's an affordable housing crisis here in San Diego. More than half of the individuals are paying about 50% of their rent, of their income, I should say, in rent. The rental rate vacancy rate is about 2%, which means there isn't a lot of vacancy. So that all comes together. It's a perfect storm almost, right? To keep the individuals who we serve really away from that housing. And so what we've done is we've committed to the community at large that we would introduce 2,000 affordable housing units throughout a period of time. And I'm happy to report that we're well on the way to do just that. And it's not just a matter of introducing the units, but it's the comprehensive services for which we're known. I mean, we've been helping people off the streets now for 70 years. But those comprehensive services, coupled with the housing, is what truly makes a difference in their lives. We provide shelter each and every single day. We're known for doing that. We've been doing it the longest in the community. But we know a shelter is not a home. We know a permanent dwelling is a home. And so I'm happy to report a number of developments. That in January of this year, we broke ground on a building that will be called St. Teresa of Calcutta Villa. It will be 14 stories high. We'll have 407 units. It will provide housing for over 550 individuals when we cut that ribbon in the first quarter of 2022. Right? So it's a ways off of it, but we're well on the way to be able to do that. This is the largest endeavor, by the way, of its kind in San Diego County for those who we serve. I mean, it's exciting as could be about it. In addition, we're well on the way to breaking ground in the middle of next year on another 14-story building on the corner of Broadway and 13th. That will have about 273 units as well, that will provide the affordable housing that's necessary, again, with the comprehensive services to bring people off the streets and help them to retain that housing through these services. And then I'm particularly excited because it's very eminent to report Benson Place, our facility, which is down in the South Bay area. And that's going to provide 82 units. It's a motel that we purchased at the tail end of last year. We started refurbishments in January. And in 3 weeks' time, I'm happy to report, on August 12th, that's the date, in fact, August 12th, we'll be cutting that ribbon. And these will be brand new units. They will be self-contained. They will have everything that's necessary necessary for an individual to prosper. And I'm going to turn it over to Bill Bostad, who's our Chief Operating Officer, and he's on site, in fact, to share with you the progress of Benson Place. Like I said, we're 3 weeks away from a ribbon cutting.
Great. Well, thank you, Deacon Jim. So as you mentioned, I'm here in the Otay Mesa Nestor community at Benson Place. It is an active construction zone. So if you hear construction noise in the background, my apologies in advance. As you can see, we're wearing the hard hat and we've got the mask, so we're fully protected. So as Deacon Jim mentioned, he gave you a little bit of a sneak peek. We haven't announced yet that grand opening is happening in August, but you heard it here first. August 12th, like everything else during COVID, it's going to be virtual. So keep an eye out on your inboxes and for that invitation, and we hope you'll be able to join us. We could not be more excited. So as Deacon Jim mentioned, Benson Place is a former Easy 8 motel, and we're converting it into 82 units of studio apartments like the one I'm standing in right now. But along with those apartments, we'll be providing comprehensive supportive services, things like behavioral health care or on-site support, or really access to the entire array of services that we offer through Father Joe's Villages. And those are the key. You see, if you place somebody into housing without the support that they need, if you don't give them an understanding of how to live on a budget, or how to seek jobs, or give them skills that help them get jobs, or give them access to healthcare, you're setting them up to fail. And that's not what we do at Father Joe's Villages. Our goal is that once we place somebody into permanent housing, they remain housed indefinitely. And that's why we provide those ongoing supportive services to help people achieve the level of self-sufficiency that they need to achieve that long-term success. So Deacon Jim referenced the Turning the Key initiative. Obviously, that is a new initiative, but the idea of us providing housing to those who are homeless and on the streets is nothing new at all. Many of you on this call may be familiar with Village Place, which was our first affordable housing complex back in 1997. Now, 23 years later, I'm happy to announce that when we open Benson Place here in a couple of weeks, that we'll have over 400 units of affordable and supportive housing throughout the city of San Diego. And in addition to that, we have nearly 700 additional units that are in the development pipeline right now that we hope to be opening in the next couple of years. And in addition to that, we provide those comprehensive services to over 460 formerly homeless men and women who are living both in our housing and in housing developed by other third-party developers. And again, those services are really the key that allows people to not only obtain the housing, but maintain it for years to come. And kind of along those lines, one of the outcomes of which we're most proud of Father Joe's Villages is that when we look at the programs where people are engaged in our supportive housing, 94% of them remain housed permanently. They remain housed for years and years and years, 94%. Those numbers are hard to argue with. And kind of along those lines too, when I'm on the theme of outcomes that we're really proud of, I want to stop and back up for a second. I think the Deacon Jim made reference to this also, that when we look at homelessness, we can't end somebody's homelessness without housing. So we're constantly trying to find a way to get people into homes of their own. COVID-19 over the last several months has made that extremely challenging, as anybody can imagine. But our housing teams, despite all of those challenges over the last several months, I'm very happy to announce that they have managed to place over 200 men, women, and families into homes of their own. 200 fewer people on the streets. Again, we are incredibly proud of the work that our teams are doing despite all of the challenges. And most importantly, we want to thank you, our supporters, for making all this happen, for making it all possible, for believing in Father Joe's Villages, and most importantly, for believing in our clients, believing that they can achieve more, that they should achieve more, that they should have a better life than a life on the streets. And just one more very heartfelt, deep gratitude, an expression of deep gratitude to Judy and Roger Benson and their family for making this wonderful project possible, not only for the people that will move in about a month, but for those that will come to call it home for decades to come. So with that, I'll turn it back to you, Deacon Jim.
Thank you, Bill. You can sense Bill's excitement and my excitement as well when we talk about the Turning the Key initiative, because these are change makers in people's lives. They truly are. And Bill gave a shout out to Judy Benson, and rightly so. She's such a wonderful lady. And she and her husband, Roger, who has since passed, have been great supporters of ours for years and years. Another shout out, actually, I'll give to Terry Castor. Terry Castor has also been a longtime supporter of ours, and he and his family gave the philanthropic portion, which is making possible St. Teresa of Calcutta Villa on Commercial and 14th, the 14-story building, 407 units that I referenced earlier in my remarks. So again, the only way we can make these things happen is through the generosity of you who are on the phone and the community. Everything we do is as a result of you believing in us and you believing in those who we serve. So thank you. So moving into the new normal. I mean, we're there actually, right? And the challenges that go along with being in that new normal. How do we adjust our programs in order to continue to be effective? And that's the key, because the mission is the same. The mission is to break the cycle of homelessness one life at a time. That has not changed. And as you've noticed from listening to my colleagues, they're hard at work in this new normal in order to ensure that that continues to happen for individuals each and every single day. Whether it means adding plexiglass, whether it means retrofitting workstations, right? Whether it means working with clients who basically don't have the wherewithal in a lot of cases in order to come up with the technology that they need to be helped virtually, right? So what do we do in that case when it comes to the Employment Education Services Center? That becomes even more important, those computer labs, because if our clients don't have what they need in order to connect, the computer lab is important, and that's on site. So how do we create a safe environment for them, and how do we create a safe environment for our team members as well? And that's the challenge. But as you could see, we stepped up into the challenge, and the creativity and the innovation that's necessary. That's always been a hallmark of Father Joe's Villages. I mean, this time I realize how blessed I am to have the team that I have, all 425 of them throughout the various programs. And so that's what it's all about. That's what it's all about. It's how do we leverage the expertise that we've developed throughout our many years. So with that, what I want to do is I want to pause. We can go on and on sharing what we do because we are so passionate about it. But I'd like to pause because I'd like to get your reaction to what you're hearing. I know there's some questions have come in, and I have them for this. I'm going to have to be referring down to the questions and reading them aloud so that you have the benefit of it. And then we'll try to answer them. I'll answer some of them, and I'll also send some over to those from whom you've heard to help me answer some of the questions as well. So with that, let's see what I have here. One question is, what are your biggest needs or concerns right now? I think I've answered that to a certain extent, but I mean, the biggest need, I guess I would say, is the assistance necessary in order to retrofit our programs. I mean, the retrofitting is happening. We're seeing what's necessary, and we're responding to that in order to best serve those who come to us, our clients and the health center, our patients there. And so it's the support to be able to do that. You'll notice we've had some match challenges throughout the last few months as an example, and a number of you have participated. It's always so encouraging and heartwarming for me and for my team to see how the community responds. And I know a lot of you have been affected as well by the challenges, and yet you step up. And so the needs right now are to continue to be responsive to what we're seeing in the community at large as it relates to this pandemic and how we respond to that. So another is, with economic conditions and the moratorium on evictions expiring soon, do you anticipate seeing more people on the streets in the coming months? I alluded to that actually earlier in my remarks. Unfortunately, I do see an impact there. I hope I'm wrong, in all honesty, but I think once that moratorium on evictions is and on rent is lifted and the unemployment checks cease, and it's going to happen at some point, I think the combination of the two, also the fact that not everyone will be back to work, will be impactful. And so my hope is that we won't see additional people on the street, but something tells me that we will. And so what we need to do is continue to prepare ourselves in order to be able to respond to that. That's the key, being able to respond to that as a village here and as a community at large. How many people do you feed and do you provide, for whom do you provide meals and house each day? And let's see here. I'm going to turn it over to Rocio actually, so she can give you a really good sense. But anyway, Rocio, would you answer that again? How many people how many meals are you providing for those who we serve? Why don't we start with that question?
Yeah, the number of meals that we provide on a daily basis, of course, varies because of the public lunch line and whether people come in the morning, noon, and night. But, we're serving over 1,500 meals a day because we're serving not only the public lunch line, our residents, Therapeutic Childcare, and as I alluded before, to our Hillcrest and our downtown location. So yes, keeping us very busy. Thank you, Deacon Jim.
CEO. And as far as how many people we either shelter or for whom we provide housing, it's over 2,100 individuals each night. And that's anywhere from a shelter bed to a permanent bed, actually. So across the board. Let's see here. Do you feel this pandemic has made shelter more available to those on the streets? I do think so. The fact that we have the convention center has been a godsend, actually. We at Father Joe's Villages, actually, we've been able to add, as a result of all the different shelter beds, we've added in total about 150 additional beds all in. If you consider what we have at the convention center, we have at our various other shelters, we actually have a full complement of over 150 additional beds. And so we've been able to do that. The key is to continue to keep that number up and increase them as we continue, as we move into, or we continue to move into this new normal, and especially when we move out of the convention center. I mean, those shelter beds are obviously necessary, and so we need to continue them. That's why the motels are so important. The motel conversion that Bill described in Benson Place is a cost-effective and efficient way of providing housing. That's much less costly, actually, than building a building, though, frankly, both are necessary in the scheme of things, right? So that's an important element. Let's see here. COVID-19 certainly presents challenges, but has it also opened any opportunities? It has. I think it's kind of in keeping with the answer to the prior question. It's presented the opportunity of adding additional shelter beds. It's presented the opportunity of being able to also distance the shelter beds and not have the shelters so dense. And that's a good thing, actually, because whether it's the coronavirus or whether it's Hep A, we heard of Hep A two years ago, or whether it's TB that rears its head every so often, there are a lot of things that impact our population. So I think it's given us an opportunity. We were always very careful here because of the nature of those whom we serve, but it's even brought that up to a heightened level in order to keep people safe, not only now, but for the going forward. How difficult is it to get clients to go to the convention center during outreach? You know, we've been fairly successful. Out of the 500 beds that we manage at the convention center, we've been pretty much, after the first month or so, we've been pretty much at 90 to 95% capacity. So we've been pretty successful at the outreach. And that's an important element. We have outreach endeavors constantly, at least once every week, actually, in order to bring people not only into the convention center, but also into our other facilities. One of our shelters has been designated the at-risk shelter during this whole pandemic. And so any individual who's either 55 years of age or older and has a pre-existing condition, or if you're 65 or older, automatically, you fall into a vulnerable category. And so we provide 175 beds just for that population within our campus itself. And so it's been an important element of the whole. And so, and that said, you know, we have more success than not in getting people to come into the convention center. Like I said, the beds are fairly full. Okay, let's see here. And let me ask her, these are, let me see. Where can clients get masks? Kathy asked us in one of the questions. By the way, people have been extremely generous at making masks for us, I have to tell you. And not that I want it to stop, but we've had a number of donors, our Ladies Guild as an example, and a number of other organizations have stepped up and asked us whether we want masks. The answer is always yes, because we utilize a lot of masks. We utilize masks not only for our team members, but also for our clients. And so that said, to date, thank God, we have not had a shortage of masks. In order for that to continue, I would encourage people who know people who make masks as an example, please to think of us. They're an important element. Let me, Bill, can you explain a little more about the role of tenant services in ending someone's homelessness? Why don't we go to you, Bill, for that answer?
Sure. Of course. Thanks, Deacon Jim. So the role of tenant services, what we find it's a little bit like what I was saying before. People are placed in housing, and many of the folks that we work with have challenges. There's reasons why they became homeless, and it might be maybe that they don't have job skills. It could be that they have a disability. They could have mental illness. That's a common one, actually. And so our tenant services team is a comprehensive team that is, they're geared to provide whatever the support is that the tenants need. So in fact, you might know that at Father Joe's Villages, we have this idea of being a one-stop shop. This sort of guiding North Star for us has been that no matter what somebody comes to our door with, whatever their challenge is, we want to have the right combination of housing and services to respond to that. Our tenant services is sort of a mobile version of that, right? They're designed to have a multidisciplinary team that includes case managers and nurses and access to our medical care professionals, all with the intention of being able to respond to the specific needs of an individual or family, so that not only can we help them obtain that housing, but that they can maintain it. And when there are challenges to that, they can help respond and access resources in the community, or help figure out what a particular client or family may need so that they can remain in that housing. And I'll tell you, having been on the other side, there was a period of time when I oversaw our portfolio of affordable housing. And I can tell you that I have high confidence in our tenant services. When we worked with a lot of providers who help provide services in housing, and I may be a little bit biased, but I found our tenant services to be the best, bar none. They were great at providing those services and making sure that the clients were well cared for.
Thank you, Bill. And actually, there's someone who's on the line. I won't mention his name, but there's someone who's on the line who was really impressed by the statistic, Bill, that you gave a few minutes ago in your remarks, and that has to do with the percentage of individuals with whom we work, who retain their housing because of the comprehensive services that we provide. And so what is that percentage again?
It was 94%, Deacon Jim. And that, again, many of you on the phone may know that at Father Joe's, we have a deep and long-standing dedication to data. So we went paperless years ago with regard to our clients' files. We actually operate what they call a digital homeless management information system, which is a computer program, and we put all of our information in there. And so when we quote statistics to you, these aren't coming off an Excel spreadsheet. They're not tick marks on a page. These are things that we have tracked in an actual, in a program, and that we do active reporting on. So we mine that data, and the intention there is to make sure that we're providing everybody that we talk to, like you, our supporters, accurate information, but more to the point, it also allows us to evaluate what's going right and what's going wrong with programs. We're constantly trying to reassess and figure out, how can we improve this? Where is something slipping that we need to help reinforce it? Where is something doing well? And what are the reasons behind that so we can do even better? So that's where that statistic comes from, and we're extremely proud of it.
Yeah. Thank you, Bill. We are proud of that, the statistic. It's a testament to the programs that we have in place and to the team that we have in place. It's quite remarkable if you think about it. So thank you for the person who wanted that reinforced. I appreciate it. Let me turn a question over to Rocio, actually. Rocio, could you discuss the procedures that we have in place to protect volunteers when they come in to assist us?
Of course, Deacon Jim, very happy to do that. And by the way, that is another need that we do have. Volunteers are always welcome at Father Joe's Villages to help us with all the different programs that we have. So I urge you to sign up and help us. We want to make sure that you are safe, though. We want to make sure that when you come in, you feel that, there's nothing to worry about. So all of the areas where we have our volunteers, we follow the same protocols that we have with our staff. You will receive a survey that will ask you if you're feeling well, if you don't have any symptoms. Aside from that, when you answer that survey and you arrive at our property, we will make sure that you have the gloves, you will have the hand sanitizer, you will have the mask, and additionally, you have an access to a face shield. The face shield is necessary if you are assisting in our food services because of the proximity of, you need to be maybe closer than 6 feet, maybe not. It depends on how the food is being served that day. But we feel that with the face shield and the mask and the gloves and the hairnet in food services and the apron, you're very, very protected. Same thing goes if you work in any other programs for the day. We want you to feel safe. We have all of those items at your disposal. We have worked very closely with the county to ensure that we have all of the items that are necessary PPE for first responders. So we have everything available for you. Thank you. We also make sure that when the volunteers come in, we have the disinfectant and the wipes to clean the surfaces, and we have protocols in place where we sanitize all the areas that we're working ongoing. So thank you, Deacon Jim. Back to you.
Thank you, Rocio. Thank you very much. In fact, from Rocio's remarks, you realize that we take it very seriously, keeping our volunteers safe, our clients safe, and our team as well. At the convention center, by the way, something that we haven't mentioned is that every single day there's a form of screening for every client who's at the convention center, including temperature taking, as well as a whole host of questions that are asked, so that if anyone is experiencing some symptoms, right away it's addressed. And those, because we know some people might be asymptomatic, that's why the testing of individuals is so extremely important. I mentioned that every 3 weeks we administer about 600 tests to those at the convention center. So that's very, very important. I wanted to turn a question over to Jennifer. Jennifer is with us from the Therapeutic Childcare Center. So this one's for you. How can we use technology to better serve the children who are home?
I'm sorry, Deacon, could you repeat that question?
Sure. How can we use technology to better serve the children who are homeless?
Yeah, so we actually are switching a lot to technology. We're doing a lot of virtual lessons, virtual classrooms. I indicated when we talked earlier about our new Brightwheel app, which is an app that we can actually send lessons home to parents that they can do with their children. We've also connected with Zoom and we can have individual tutoring sessions with the children. And so technology is really becoming a very important player in what we do, in staying connected and engaged with our kids of all ages. And then making sure that they have the technology so that they can be successful. For example, with this distance learning in schools, the schools are providing some of the technology that they need, but we're also providing additional technology here in Therapeutic Childcare, upping up our Wi-Fi available for them, and having our own systems available so that if theirs aren't working, they have a place that they can come and use that technology over here.
Thank you, Jennifer. I appreciate your response there. A few other questions here. Will the Neilgood Daycare Center remain operative? Some of you may realize that we operate for the city a daycare center, or day center, I should say, not daycare, but a day center out of the East Village. It is for adult single men and women who come in. The hours are just during the day, but they're able to come in. They're able to have their clothes washed. They're able to take showers. They're able to start connecting to services, which is extremely important. That's an important element as well. And so we also connect them with various other service providers, such as the Department of Motor Vehicles and the like. So it's an important element and complement of what we do. For the time being, that will be remaining open. As far as we know, like I said, we have a city contract. The city has renewed the contract with us. And so the intention thus far is for that to remain open. The density has been reduced tremendously during the pandemic, and because of the distancing that's required. And so it's, again, operating in a different way, but still for the purposes of helping people who are on the streets. Will you still be offering religious services? We do. We have a chaplaincy program. In fact, we just hired a new chaplain, our former chaplain who have been with us, Sister Carmel. She's retired. She's going back to her homeland of Ireland, and we've hired someone new who happens to be a deacon, actually, of the Catholic Church, Deacon John Roberts, and he joined us a couple of months ago. So he runs the chaplaincy program. That's an important element because there's a lot of brokenness, as you can imagine. I mean, none of us escapes brokenness in one fashion or another. Those who are mired with homelessness, besides not having a roof over their heads and food on the table, there's also a lot more that's at play. And so people appreciate being able to utilize a chaplaincy program. We serve all denominations, as you can imagine. Homelessness does not discriminate. We have all ethnic groups. We have all religions represented. And so anyone of any religion can come. We do have a Catholic Mass here, but we also open it up to other religious denominations and their respective ministers come in. and offer services as well. And we offer non-denominational services as well. That's an important element of what we do, because we do believe that the spiritual aspect is very important in the whole healing process. Let's see here. We have, okay, this is one. I'm just going to read it. Outside of needing community donations to support daily operating budgets, do you need San Diego's real estate developers to donate more land property to support your efforts to house the homeless? The answer is yes. Okay. We can always, land is very precious in this town, as you can imagine. But with land, we've been blessed with having land. The commercial 14 site, as an example, on which we're building a 14-story building. We've owned that piece of land now for many, many years. And so that's why we're building there. And with land, we have the opportunity then to be able to also construct. We're looking for motels and hotels, obviously. They're a very cost-effective way of addressing the affordable housing crisis as well. So these are important elements of our Turning the Key initiative. The cost of maintaining the housing and multiple services for clients is a big, big job. What's your financial vision for Father Joe's Village's future goals, since this will grow in the near future? Okay. One thing that I haven't mentioned, I don't believe Bill mentioned either, is an important element of our Turning the Key initiative, and that's the sustainability of that program. The financial model that's been built for each and every single one of these buildings is such that the rents that are secured pay for the operating costs of the building, as well as for the services that are provided. Benson Place is a permanent supportive housing, so the individuals who are there, as Bill mentioned, have mental illness that plagues them. They have disabilities and so forth. So they need services, ongoing services. So each building is self-contained and self-sustaining. So that, as I mentioned, the rents provide for everything that's needed there. Once this is put in place, there aren't any more philanthropic dollars that are needed in order to then continue each of these buildings. And that was an important element as we built the financial model for Turning the Key, and we started working on this 3 years ago. So the reality is that with land and then the public funding that we secure in order to build the edifices or to renovate the motels, once we have that, then people who are there I should say the buildings themselves are there for the future, for the long term, in order to continue to help people off the streets and into permanent dwellings. So I hope I answered that question. And with that, I think you've been great. You've been great at asking questions. I really do appreciate the questions. Like as I mentioned, we're passionate about this. We can continue to talk about our programs, but I did want to allow an appropriate amount of time to get your reaction and your questions. I'll start where I began, by thanking you. Thanking you for attending this afternoon. I know you're busy, and so you've taken time out of your busy schedules to be with us, and I very much appreciate it. I hope you've gotten a good sense of what we're doing, especially what we've been doing of late. And most importantly, please, if nothing else, I want you to walk away feeling that we are extremely grateful to you, extremely grateful for your support that you've given us, some of you, throughout the many, many years. I cannot thank you enough. That's how we're able to do what we do. I appreciate that you believe in us and in our mission. I appreciate that you believe in those who we serve. They have the potential. We see that time and time again. With the right resources, they rise up, all right? And they're able to get out of this plight of homelessness and move forward. And that's what gives us the satisfaction each and every single day. So thank you, and God bless you. And I hope you're able to join us again on one of these other future virtual meetings. God bless you.